NCLEX Exam Sample Test 2026 Practice Questions and Rationales. Question 1. When suctioning a client with tuberculosis who is on a ventilator, the nurse should: Option A, suction for a maximum of 20 seconds. Option B, hyperoxygenate before and after suctioning. Option C, suction for a maximum of 30 seconds. Option D, maintain clean technique during suctioning. The correct answer is option B, hyperoxygenate before and after suctioning. The nurse should provide extra oxygen to prevent hypoxia and always use strict sterile technique. Question 2. Why is vitamin B6 given with isoniazid for tuberculosis treatment? Option A. It increases the activity of isoniazid. Option B. It increases the activity of rifampin. Option C. It improves overall nutritional status. Option D. It reduces peripheral neuropathy. The correct answer is option D. It reduces peripheral neuropathy. Isoniazid can cause a deficiency of vitamin B6, which leads to nerve damage and tingling in the extremities. Question 3. Which nursing action is essential to prevent the development of drug-resistant tuberculosis? Option A, monitor liver function. Option B, monitor renal function. Option C, assess knowledge of respiratory isolation. Option D, monitor compliance with drug therapy. The correct answer is option D, monitor compliance with drug therapy. The primary cause of drug resistance is the mutation of organisms when the client does not take the full course of medication exactly as prescribed. Question 4. To facilitate maximum air exchange, the nurse should position the client: Option A, in a high Fowler's position. Option B, in an orthopneic position. Option C, in a prone position. Option D, in a flat supine position. The correct answer is option B, in an orthopneic position. The orthopneic position, which involves sitting up and leaning forward, allows for the greatest lung expansion. Question 5. For lunch, a client drank 8 ounces of milk, 4 ounces of tea, and 6 ounces of coffee. How many milliliters should the nurse record? Option A, 500. Option B, 540. Option C, 600. Option D, 655. The correct answer is option B, 540. 18 total ounces times 30 milliliters per ounce equals 540 milliliters. Question 6. A client says, I have pain in my left shoulder. How is this documented? Option A, evaluation process. Option B, objective information. Option C, subjective information. Option D, a complaint. The correct answer is option C, subjective information. Subjective information is anything reported by the client that cannot be directly measured by the nurse. Question 7. Before completing a nursing diagnosis, the nurse must first: Option A, write goals and objectives. Option B, perform an assessment. Option C, plan interventions. Option D, perform an evaluation. The correct answer is option B, perform an assessment. Assessment is the first step of the nursing process and provides the data needed to form a diagnosis. Question 8. When inserting a nasogastric tube, once it passes the oropharynx, the nurse should tell the client to: Option A, tilt her head backwards. Option B, swallow as the tube passes. Option C, hold her breath. Option D, cough as the tube passes. The correct answer is option B, swallow as the tube passes. Swallowing helps the tube move into the esophagus and keeps the airway closed to prevent the tube from entering the lungs. Question 9. When assessing residual volume in a tube, feeding, the feeding should be delayed if the amount exceeds: Option A, 20 milliliters. Option B, 25 milliliters. Option C, 30 milliliters. Option D, 50 milliliters. The correct answer is option D, 50 milliliters. Large residual volumes indicate that the stomach is not emptying and can increase the risk of aspiration. Question 10. A client with cirrhosis of the liver should be on which type of diet? Option A, high protein and high calorie. Option B, high calorie and high carbohydrate. Option C, low fat and 2 gram sodium. Option D, high protein and high fat. The correct answer is option B, high calorie and high carbohydrate. High carbohydrates provide calories to prevent tissue breakdown, while a high-protein diet is contraindicated because it increases ammonia levels. Question 11. What is the primary cause of ascites in a client with liver failure? Option A, decreased plasma proteins. Option B, electrolyte imbalance. Option C, decreased renal function. Option D, portal hypertension. The correct answer is option A, decreased plasma proteins. A decrease in albumin and other plasma proteins leads to a loss of osmotic pressure and fluid leaks into the abdomen. Question 12. A common complication of cirrhosis is prolonged bleeding. Which vitamin should the nurse be prepared to administer? Option A, vitamin C. Option B, vitamin K. Option C, vitamin E. Option D, vitamin A. The correct answer is option B, vitamin K. Vitamin K is essential for blood clotting and its absorption depends on liver function. Question 13. Which food should a client with a permanent colostomy avoid? Option A, peanut butter and jelly. Option B, corned beef and cabbage. Option C, oatmeal and toast. Option D, tuna on whole wheat bread. The correct answer is option B, corned beef and cabbage. Gas-forming foods like cabbage can cause discomfort and odor issues for clients with a colostomy. Question 14. A nurse finds white patches on a client's buccal mucosa that cannot be rubbed off. What does the nurse suspect? Option A, xerostomia. Option B, candidiasis. Option C, leukoplakia. Option D, stomatitis. The correct answer is option C, leukoplakia. Leukoplakia is a thick white patch that cannot be removed by rubbing, whereas candidiasis or thrush can be rubbed off but will bleed. Question 15. Which statement about human immunodeficiency virus requires further education? Option A. The virus is transmitted by sexual contact. Option B. Condoms reduce the transmission of the virus. Option C. The virus is easily transmitted by casual contact. Option D. The virus can be transmitted to an unborn infant. The correct answer is option C. The virus is easily transmitted by casual contact. The virus is not spread through casual contact like hugging or sharing food. Question 16. A client is diagnosed with an astrocytoma, which is a benign brain tumor. What should the nurse know? Option A. It is just as dangerous as a malignant tumor. Option B. It grows more rapidly than a malignant tumor. Option C. It does not warrant concern. Option D. It can always be removed surgically. The correct answer is option A. It is just as dangerous as a malignant tumor. Even a benign tumor can cause death or disability by increasing intracranial pressure or compressing vital structures. Question 17. A client is admitted with renal calculi and severe flank pain. What is the most important nursing action? Option A, intake and output measurement. Option B, daily weights. Option C, straining of all urine. Option D, administration of oxygen therapy. The correct answer is option C, straining of all urine. Straining urine is essential to catch and identify the stones and to track their passage. Question 18. A client's renal stones are made of calcium phosphate. Which diet is appropriate? Option A, high calcium and low phosphorus. Option B, low calcium and high phosphorus. Option C, 2-gram sodium diet. Option D, low calcium and phosphorus and acid ash. The correct answer is option D, low calcium and phosphorus and acid ash. Restricting the minerals that form the stones and eating an acid ash diet helps prevent the formation of more calculi. Question 19. A client is admitted with diabetic ketoacidosis. Which insulin should the nurse anticipate giving? Option A, Humulin N. Option B, Humulin R. Option C, Humulin U. Option D, Humulin L. The correct answer is option B, Humulin R. Humulin R or regular insulin is the only rapid-acting insulin suitable for intravenous use in an emergency. Question 20. What type of intravenous solution is used to correct extracellular fluid depletion in a client with ketoacidosis? Option A, 5% dextrose in normal saline. Option B, 5% dextrose in water. Option C, 0.9% normal saline. Option D, 5% dextrose in lactate ringers. The correct answer is option C, 0.9% normal saline. Isotonic normal saline is used for initial fluid replacement without adding extra sugar to the blood. Question 21. A client with diabetes insipidus has which type of urine output pattern? Option A, anuria. Option B, oliguria. Option C, dysuria. Option D, polyuria. The correct answer is option D, polyuria. Diabetes insipidus is characterized by the production of large amounts of very dilute urine. Question 22. Which blood product is best when a large volume of blood has been lost in a motor vehicle accident? Option A, whole blood. Option B, platelets. Option C, fresh frozen plasma. Option D, packed red blood cells. The correct answer is option A, whole blood. Whole blood contains all the components that are lost during active bleeding. Question 23. What is the expected response to sodium polystyrene sulfonate treatment? Option A, increase in serum magnesium. Option B, increase in serum bicarbonate. Option C, decrease in serum potassium. Option D, decrease in serum calcium. The correct answer is option C, decrease in serum potassium. This medication binds with potassium in the colon so it can be excreted in the feces to treat high potassium levels. Question 24. A Cheyne-Stokes respiratory pattern is most often associated with which condition? Option A, diabetic ketoacidosis. Option B, fever. Option C, increased intracranial pressure. Option D, spinal meningitis. The correct answer is option C, increased intracranial pressure. This irregular breathing pattern is a classic sign of neurological distress or pressure changes in the brain. Question 25. Why is it important for a client with type 2 diabetes to consume the recommended daily allowance of magnesium? Option A, magnesium prevents heart disease. Option B, low magnesium can increase insulin resistance. Option C, magnesium prevents high blood pressure. Option D, magnesium is needed for healthy bones. The correct answer is option B, low magnesium can increase insulin resistance. Low levels of magnesium can lead to carbohydrate intolerance and make it harder for the body to use insulin. Question 26. The finding of normal breath sounds on the right and diminished sounds on the left of a newly intubated client is likely due to option A, a left hemothorax. Option B, a right hemothorax. Option C, intubation of the right mainstem bronchus. Option D, an inadequate mechanical ventilator. The correct answer is option C, intubation of the right mainstem bronchus. If the tube is pushed too deep, it usually enters the right side, blocking air from reaching the left lung. Question 27. Which blood gas parameter primarily reflects the function of the respiratory system? Option A, partial pressure of carbon dioxide. Option B, carbon dioxide content of the blood. Option C, bicarbonate. Option D, base excess. The correct answer is option A, partial pressure of carbon dioxide. The lungs are responsible for regulating carbon dioxide, and this measurement directly reflects how well they are working. Question 28. What is the maximum safe pressure for an endotracheal tube cuff? Option A, 10 mm of mercury. Option B, 20 mm of mercury. Option C, 45 mm of mercury. Option D, 60 mm of mercury. The correct answer is option B, 20 mm of mercury. Pressures above 20 can cause tracheal erosion and damage to the tissues. Question 29. Which solution is compatible with phenytoin for intravenous administration? Option A, Ringer's lactate. Option B, 5% dextrose in water. Option C, 5% dextrose with Ringer's lactate. Option D, normal saline. The correct answer is option D, normal saline. Phenytoin will precipitate or clump if mixed with any solution other than normal saline. Question 30. Which nursing diagnosis has the highest priority for a client with second and third degree burns to the face and neck? Option A, fluid volume deficit. Option B, alteration in comfort and pain. Option C, alteration in sensation. Option D, alteration in airway integrity. The correct answer is option D, alteration in airway integrity. Edema in the face and neck can rapidly close the airway, making breathing impossible and intubation difficult. Question 31. What is the purpose of the water seal bottle in a 3-bottle chest drainage system? Option A, to collect drainage. Option B, to regulate pressure. Option C, to prevent blood from building up around the heart. Option D, to prevent air from entering the chest upon inspiration. The correct answer is option D, to prevent air from entering the chest upon inspiration. The water seal acts as a one-way valve that keeps the negative pressure in the chest so the lungs can stay expanded. Question 32. Which serum laboratory value should a nurse monitor during gentamicin therapy? Option A, creatinine. Option B, sodium. Option C, calcium. Option D, potassium. The correct answer is option A, creatinine. Gentamicin is nephrotoxic, so monitoring kidney function through creatinine levels is essential. Question 33. A nurse notices redness and warmth at the insertion site of a central line. What is the correct action? Option A, discontinue the central line immediately. Option B, begin a peripheral intravenous line. Option C, document the findings and notify the physician. Option D, clean the site and leave it open to the air. The correct answer is option C, document the findings and notify the physician. The nurse must report signs of infection to the physician, who will then decide if the line needs to be removed. Question 34. A nurse sees blue sputum while suctioning a client with a tracheostomy who is receiving tube feeding dyed blue. What does this mean? Option A, the client aspirated the tube feeding. Option B, the nurse placed the suction catheter in the esophagus. Option C, this is a normal finding. Option D, the feeding is infusing directly into the trachea. The correct answer is option A, the client aspirated the tube feeding. If the tube feeding appears in the airway secretions, it is a sign that the client has aspirated the formula into their lungs. Question 35. Which intravenous medication is the drug of choice for pain control in a client with pancreatitis? Option A, morphine sulfate. Option B, ketorolac-tromethamine. Option C, promethazine. Option D, meperidine. The correct answer is option D, meperidine. Morphine can cause spasms in the pancreatic duct, which increases pain. Meperidine is used because it does not have this effect. Question 36. If a nurse is unable to palpate a dorsalis pedis pulse in a male client, what is the first action? Option A, palpate again in 15 minutes. Option B, use a Doppler to determine the presence of a pulse. Option C, document that the pulse is absent. Option D, call the physician immediately. The correct answer is option B, use a Doppler to determine the presence of a pulse. A Doppler is used to find pulses that are too weak to be felt by touch alone before assuming blood flow is gone. Question 37. What response should a nurse expect after a client takes metoclopramide? Option A, increase in gastric secretions. Option B, increase in peristalsis and gastric emptying. Option C, disorientation. Option D, drowsiness. The correct answer is option B, increase in peristalsis and gastric emptying. Metoclopramide is used to speed up the movement of food through the stomach and intestines. Question 38. What is the typical legal sequence for seeking informed consent from a next of kin for an unconscious adult? Option A, parent then spouse then child then sibling. Option B, spouse then adult child then parent then sibling. Option C, spouse then parent then sibling then child. Option D, parent then spouse then sibling then child. The correct answer is option B, spouse then adult child then parent then sibling. In most legal jurisdictions, the spouse has the primary right to give consent, followed by adult children then parents. Question 39. A nurse observes a small amount of bloody drainage on a fresh surgical dressing. How is this documented? Option A, serosanguinous. Option B, purulent. Option C, sanguinous. Option D, catarrhal. The correct answer is option C, sanguinous. Sanguinous drainage is composed mostly of blood and is expected immediately after surgery. Question 40. What occurs when a surgical incision separates and abdominal organs protrude through the wound? Option A, excoriation. Option B, dehiscence. Option C, decortication. Option D, evisceration. The correct answer is option D, evisceration. Evisceration is a medical emergency where the wound opens and the internal viscera spill out. Question 41. What does red granulated tissue in a surgical incision indicate? Option A, the wound is infected. Option B, the wound is not healing. Option C, the wound is necrotic. Option D, the wound is healing properly. The correct answer is option D, the wound is healing properly. Granulated tissue is made of new fragile capillaries and indicates a healthy healing process. Question 42. 6 hours after a bypass graft, a client's foot is cool and dusky and the pulse cannot be felt. What is the priority action? Option A, continue to monitor the foot. Option B, notify the physician immediately. Option C, reposition and reassess the foot. Option D, assure the client that his foot is fine. The correct answer is option B, notify the physician immediately. The client is in danger of losing the limb due to a lack of blood supply and needs immediate surgical intervention. Question 43. Why might a surgeon use the saphenous vein instead of the internal mammary artery for a bypass? Option A. The artery takes more time to remove. Option B. The artery has a greater risk of re-occluding. Option C. The artery is smaller in diameter. Option D. The artery has too many valves. The correct answer is option A. The artery takes more time to remove. While the mammary artery may last longer, it takes significantly more time and effort to harvest than the saphenous vein. Question 44. Which electrolyte is most important to monitor after a coronary artery bypass graft? Option A. Chloride. Option B. Bicarbonate. Option C. Potassium. Option D. Sodium. The correct answer is option C. Potassium. Low potassium levels can lead to dangerous and life-threatening heart rhythm disturbances after cardiac surgery. Question 45. Which principle is essential for protecting the skin around a colostomostoma? Option A. Tape a pouch if it starts to leak. Option B. Cut the skin barrier 1.5 inches larger than the stoma. Option C. Change the pouch only when leakage occurs. Option D. Use a skin sealant under pouch adhesives. The correct answer is option D. Use a skin sealant under pouch adhesives. Skin sealants help keep the skin intact when the adhesive is removed, preventing irritation and breakdown. Question 46. Which statement indicates a client understands the care of their ascending colon colostomy? Option A. I know I am not supposed to irrigate my colostomy. Option B. My stool will be soft like paste. Option C. My stoma should be red and slightly raised. Option D. The skin may be irritated by enzymes in my stool. The correct answer is option C. My stoma should be red and slightly raised. A healthy stoma is moist, red and slightly raised. The stool in this part of the colon is usually formed and less irritating than ileostomy drainage. Question 47. A client who had a below-the-knee amputation complains of pain in his missing foot. What should the nurse do? Option A. Remind him that the leg is gone and he will be okay. Option B. Call for a psychological consultation. Option C. Turn on the television to distract him. Option D. Give him the ordered dose of meperidine. The correct answer is option D. Give him the ordered dose of meperidine. Phantom pain is a real sensation and should be treated with prescribed pain medication just like any other physical pain. Question 48. What is a major complication to monitor for immediately after a thyroidectomy? Option A. Respiratory obstruction. Option B. Hypercalcemia. Option C. Fistula formation. Option D. Myxedema. The correct answer is option A. Respiratory obstruction. Swelling in the throat or internal bleeding can compress the trachea and block the airway. Question 49. A client is concerned about a small amount of blood in his urine after a prostate resection. What should the nurse explain? Option A. It should not be there on the second day. Option B. It will stop when the catheter is removed. Option C. Some blood is normal for several days after surgery. Option D. It can be removed by irrigating the bladder. The correct answer is option C. Some blood is normal for several days after surgery. Mild hematuria is expected while the surgical site heals and the nurse should reassure the client. Question 50. What should a nurse tell a client who is concerned about incontinence after a catheter is removed following prostate surgery? Option A. It will resolve in an hour. Option B. This is usually temporary and will improve. Option C. The nurse will just keep you dry. Option D. It is caused by bladder spasms. The correct answer is option B. This is usually temporary and will improve. Incontinence is a common temporary issue after prostate surgery while the muscles regain their strength. Question 51. Which priority nursing diagnosis is common for a client after a cholecystectomy? Option A. Knowledge deficit. Option B. Urinary retention. Option C. Impaired physical mobility. Option D. Ineffective breathing pattern. The correct answer is option D. Ineffective breathing pattern. Because the incision is near the diaphragm, clients are often reluctant to take deep breaths, which increases the risk of pneumonia. Question 52. What is an appropriate nursing intervention for a client after a left pneumonectomy? Option A. Monitoring the chest tubes. Option B. Positioning the client on the right side. Option C. Positioning in semi-Fowlers with a pillow under the back. Option D. Monitoring the right lung for an increase in RALs. The correct answer is option D. Monitoring the right lung for an increase in RALs. There are usually no chest tubes on the side of the removed lung, so monitoring the remaining lung for fluid overload is the priority. Question 53. A nurse sees fresh blood on a dressing after a pneumonectomy. What is the first action? Option A. Reinforce the dressing. Option B. Continue to monitor the dressing. Option C. Notify the physician immediately. Option D. Note the time and amount of blood. The correct answer is option C. Notify the physician immediately. Fresh blood may indicate an internal hemorrhage that requires immediate medical attention or a return to surgery. Question 54. A client with a kidney transplant develops fever malaise and an increased white blood cell count 3 months later. This is option A. Acute rejection. Option B. Chronic rejection. Option C. Hyperacute rejection. Option D. Hyperchronic rejection. The correct answer is option A. Acute rejection. These are classic signs of acute rejection which typically occurs weeks to months after the transplant. Question 55. Which statement by a client shows they understand the recovery from a vertical partial laryngectomy? Option A. I know I will need special swallowing training. Option B. The quality of my voice will be excellent. Option C. I will have very little difficulty swallowing. Option D. I may need a radical neck dissection. The correct answer is option C. I will have very little difficulty swallowing. Unlike a horizontal partial laryngectomy, the vertical procedure does not typically interfere with the swallowing mechanism. Question 56. What is the priority nursing diagnosis for a client after a laryngectomy? Option A. Activity intolerance. Option B. Ineffective airway clearance. Option C. High risk for infection. Option D. Altered oral mucous membrane. The correct answer is option B. Ineffective airway clearance. The client will have many secretions and may require frequent suctioning and care of the tracheostomy tube to maintain an open airway. Question 57. A client is scheduled for a pneumonectomy and is very anxious. What should the nurse do? Option A. Provide opportunities for the client to ask questions and talk. Option B. Provide distractors like reading or television. Option C. Tell her not to be nervous and everything will be okay. Option D. Remind her that this surgery is less extensive than her last one. The correct answer is option A. Provide opportunities for the client to ask questions and talk. Clarifying misunderstandings and allowing the client to verbalize fears is the best way to reduce preoperative anxiety. Question 58. A severely anxious client repeatedly dusts his room. What is the best initial response by the nurse? Option A. You will not be allowed to stay here if you continue. Option B. I see how uncomfortable you are, but I would like you to walk with me. Option C. Tell me why your room needs to be so clean. Option D. I have inspected this room and it is already clean. The correct answer is option B. I see how uncomfortable you are, but I would like you to walk with me. Acknowledging the anxiety and redirecting the energy into a positive activity like walking is most therapeutic. Question 59. What does a client need to know about amitriptyline? Option A. It causes extrapyramidal side effects. Option B. It will relieve all anxiety. Option C. It should relieve symptoms of depression. Option D. Weekly blood tests are required for toxicity. The correct answer is option C. It should relieve symptoms of depression. Amitriptyline is a tricyclic antidepressant designed to improve mood and treat depression. Question 60. What is the primary reason for the compulsive cleanliness seen in some anxious clients? Option A. To reduce their overall anxiety. Option B. To avoid going to psychotherapy. Option C. To manipulate the health team. Option D. To show they have higher standards than others. The correct answer is option A. To reduce their overall anxiety. Compulsive rituals are used as an irrational attempt to gain control and lower the level of internal distress. Question 61. A client develops paralysis in her legs with no organic cause following a stressful lifestyle change. This is option A. Housework phobia. Option B. Malingering. Option C. Conversion reaction. Option D. Agoraphobia. The correct answer is option C. Conversion reaction. Conversion reaction is the physical manifestation of an emotional conflict where the body expresses the stress as a physical symptom. Question 62. A client performs an involved ritual in the morning that makes him late for breakfast. What is the best approach? Option A. Allow him to eat late every day. Option B. Suggest he do the rituals after he eats. Option C. Get him up early so he can finish before breakfast. Option D. Ask him to wake up the other clients to distract him. The correct answer is option C. Get him up early so he can finish before breakfast. Interrupting the ritual will increase anxiety, so the nurse should adjust the schedule to allow him to complete it while still participating in unit life. Question 63. A client with a bleeding ulcer caused by emotional problems is being interviewed. The nurse should expect the client to express feelings of option A, guilt, option B, shame, option C, despair, option D, anger. The correct answer is option D, anger. Psychophysiological disorders like ulcers are frequently associated with repressed or unexpressed anger. Question 64. What is a key factor in planning care for a client with an emotionally induced ulcer? Option A. The priority is limited to medical management. Option B. There is no real psychological basis. Option C. The disorder is a threat to his physical well-being. Option D. The client is unable to participate in planning. The correct answer is option C. The disorder is a threat to his physical well-being. Although the cause may be emotional, the physical damage like a bleeding ulcer can be life-threatening. Question 65. Which statement about agoraphobia is true? Option A. The behavior is not considered disabling. Option B. More men suffer from it than women. Option C. The fears are persistent and avoidance is used as a coping mechanism. Option D. It is treated primarily with chlorpromazine. The correct answer is option C. The fears are persistent and avoidance is used as a coping mechanism. Agoraphobia is a severe disorder where the individual avoids public spaces to escape extreme anxiety. Question 66. A nurse is assigned to a suspicious client with schizophrenia. What is the primary reason for assigning only one specific nurse per shift? Option A. To protect her from suicide. Option B. To enable her to develop trust. Option C. To supervise her medication. Option D. To involve her in group social interactions. The correct answer is option B. To enable her to develop trust. Consistency in caregiving is essential for helping a paranoid or suspicious client feel safe and begin to build a relationship. Question 67. A client taking chlorpromazine is going on a picnic in the park. What side effect should the nurse consider? Option A. Hypotension. Option B. Photosensitivity. Option C. Excessive appetite. Option D. Dryness of the mouth. The correct answer is option B. Photosensitivity. Phenothiazines like chlorpromazine can cause severe sunburns, so the client must be protected from direct sunlight. Question 68. What is the most basic intervention for improving withdrawn behavior in a client with schizophrenia? Option A. Assign her to occupational therapy. Option B. Have her sit with the nurses during charting. Option C. Help her make friends with other clients. Option D. Facilitate one-to-one communication. The correct answer is option D. Facilitate one-to-one communication. A withdrawn person must first learn to communicate with one person in a safe environment before progressing to groups. Question 69. A manic client speaks rapidly and changes the subject irrationally. This is called option A. Flight of ideas. Option B. Delusions. Option C. Hallucinations. Option D. Echolalia. The correct answer is option A. Flight of ideas. Flight of ideas is a classic manic symptom where the person jumps quickly from one thought to another without logic. Question 70. At what blood level can lithium toxicity begin to occur? Option A. 1.0 milliequivalents per liter. Option B. 2.2 milliequivalents per liter. Option C. 0.03 milliequivalents per liter. Option D. 1.5 milliequivalents per liter. The correct answer is option D. 1.5 milliequivalents per liter. While maintenance levels or lower toxicity symptoms can often begin to appear once the level reaches 1.5. Question 71. What is the best approach for a manic client who is meddling with others and dominating the group? Option A. Seclude him in his room immediately. Option B. Set consistent limits on his behavior. Option C. Ask the doctor to increase his medication. Option D. Ignore him and tell others he is just ill. The correct answer is option B. Set consistent limits on his behavior. Consistent limit setting helps the client understand what behavior is acceptable and maintains unit safety. Question 72. A hyperactive client will not sit down for meals. What is the most therapeutic action? Option A. Insist that she remain at the table. Option B, order a high-calorie diet with supplements. Option C, provide nutritious finger foods several times a day. Option D, offer to open and inspect her food for her. The correct answer is option C, provide nutritious finger foods several times a day. Finger foods allow the client to get necessary calories while on the move without the anxiety of sitting still. Question 73. What is the most therapeutic activity for a hyperactive client with flight of ideas? Option A, doing intricate crafts. Option B, working a 1,000-piece puzzle. Option C, playing bridge with 3 others. Option D, playing basketball in the gym. The correct answer is option D, playing basketball in the gym. High-energy physical activities help the client channel their energy in a positive way without requiring long periods of concentration. Question 74. When is the potential for suicide the greatest in a depressed client? Option A, in the acutely depressed state. Option B, when the depression starts to lift. Option C, during the denial phase. Option D, during a manic episode. The correct answer is option B, when the depression starts to lift. As the depression lifts, the client regains the physical energy needed to carry out a suicide plan. Question 75. Why is succinylcholine chloride given before electroconvulsive therapy? Option A, to relax the muscles. Option B, to relieve anxiety. Option C, to reduce secretions. Option D, to act as an anesthetic. The correct answer is option A, to relax the muscles. This medication is a muscle relaxant that decreases the intensity of the seizure and prevents bone fractures. Question 76. Which high-risk symptom should a pregnant client report immediately? Option A, constipation. Option B, urinary frequency. Option C, breast tenderness. Option D, abdominal pain. The correct answer is option D, abdominal pain. Abdominal pain can be a sign of spontaneous abortion, preterm labor, or placental abruption. Question 77. What is the most likely reason for poor fetal growth in a client who smokes and drinks alcohol? Option A, the client's young age. Option B, the client's previous abortion. Option C, maternal vasoconstriction and reduced oxygen availability. Option D, late prenatal care. The correct answer is option C, maternal vasoconstriction and reduced oxygen availability. Tobacco and drugs cause the blood vessels to constrict, reducing the flow of oxygen and nutrients to the baby. Question 78. Why is the embryonic period from weeks 4 to 8 so critical? Option A, duplication of genetic information takes place. Option B, organogenesis occurs. Option C, subcutaneous fat builds up. Option D, kidneys begin to secrete urine. The correct answer is option B, organogenesis occurs. During this period, all major internal and external organs are formed, making the embryo highly vulnerable to malformations. Question 79. Which hormone must be present in serum or urine to diagnose pregnancy? Option A, human chorionic gonadotropin. Option B, estrogen. Option C, alpha-fetoprotein. Option D, sphingomyelin. The correct answer is option A, human chorionic gonadotropin. Human chorionic gonadotropin is the biochemical basis for all standard pregnancy tests. Question 80. A client has 2 living children, 1 spontaneous abortion and 1 infant who died at 3 months. How is her history recorded? Option A, gravida 4 para 2 abortion 1. Option B, gravida 5 para 3 abortion 1. Option C, gravida 5 para 4 abortion 0. Option D, gravida 4 para 3 abortion 0. The correct answer is option B, gravida 5 para 3 abortion 1. The client has been pregnant 5 times, counting the current one G5. She has delivered 3 infants after 20 weeks P3 and had 1 abortion A1. Question 81. A client only shows signs of diabetes when she is pregnant. This is classified as option A, insulin-dependent diabetes. Option B, type 2 diabetes mellitus. Option C, type 1 diabetes mellitus. Option D, gestational diabetes mellitus. The correct answer is option D, gestational diabetes mellitus. Gestational diabetes is defined by the onset of symptoms during pregnancy and usually disappears after delivery. Question 82. Why is a fetal ultrasound performed before an amniocentesis? Option A, to evaluate fetal lung maturity. Option B, to evaluate the amount of fluid. Option C, to locate the position of the placenta and fetus. Option D. To ensure the fetus is mature enough. The correct answer is option C. To locate the position of the placenta and fetus. Ultrasound is used to guide the needle away from the baby and the placenta to prevent injury. Question 83. Which assessment finding is a concern for a 36-week pregnant client? Option A. Complaints of shortness of breath. Option B. Edema of the face and hands. Option C. Pulse of 73 beats per minute. Option D. Hematocrit of 39%. The correct answer is option B. Edema of the face and hands. Edema of the face and hands can be an early warning sign of preeclampsia. Question 84. Which statement is true for autosomal recessive genetic disorders? Option A. Heterozygotes are affected. Option B. The disorder is always on the X chromosome. Option C. Only females are affected. Option D. Two affected parents always have affected children. The correct answer is option D. Two affected parents always have affected children. If both parents have the disorder, every child will receive two recessive genes and will also be affected. Question 85. Chorioamnionitis is a maternal infection usually associated with option A. Prolonged rupture of membranes. Option B. Post-term deliveries. Option C. Maternal pyelonephritis. Option D. Maternal dehydration. The correct answer is option A. Prolonged rupture of membranes. When the membranes are ruptured for a long time, bacteria can enter the uterus and infect the amniotic sac. Question 86. What is the most likely cause of blood clots and thrombophlebitis during pregnancy? Option A. Increased coagulation factors and decreased fibrinolysis. Option B. Inadequate production of platelets. Option C. Inadequate intake of folic acid. Option D. Increase in fibrinolysis and decrease in coagulation. The correct answer is option A. Increased coagulation factors and decreased fibrinolysis. Pregnancy naturally increases the body's clotting ability while decreasing the breakdown of clots to prevent hemorrhage during birth. Question 87. Which signs of a heparin overdose should a postpartum nurse monitor for? Option A. Dysuria. Option B. Epistaxis and hematuria. Option C. Vertigo and fainting. Option D. Hematuria and nosebleeds and bruising. The correct answer is option D. Hematuria and nosebleeds and bruising. Bleeding from the nose or in the urine along with easy bruising are classic signs of too much anticoagulant. Question 88. What are the clinical signs of mastitis in a breastfeeding mother? Option A. Engorgement with fever and a red hardened area. Option B. Simple breast pain. Option C. Malaise and low fever. Option D. Cracked and sore nipples. The correct answer is option A. Engorgement with fever and a red hardened area. Mastitis is a bacterial infection marked by localized redness, heat, and flu-like symptoms in the mother. Question 89. A client carrying triplets at 32 weeks has low back pain and regular mild contractions. What does this indicate? Option A. Her cervix is about to dilate. Option B. This is common and not a concern. Option C. She may be in preterm labor. Option D. She most likely has a urinary tract infection. The correct answer is option C. She may be in preterm labor. Regular contractions and back pressure in a multiple pregnancy are high-risk signs for preterm labor. Question 90. What is the most frequent cause of early postpartum hemorrhage? Option A. Hematoma. Option B. Coagulation disorders. Option C. Uterine atony. Option D. Retained placental fragments. The correct answer is option C. Uterine atony. Failure of the uterus to contract and stay firm is the leading cause of heavy bleeding in the first 24 hours after birth. Question 91. How should a nurse respond to a mother who just lost her baby and is shouting in anger? Option A. Leave her alone and give her privacy. Option B. Tell her she is young and can have more children. Option C. Tell her the child is an angel in heaven. Option D. Acknowledge her anger as a normal stage of grief and offer support. The correct answer is option D. Acknowledge her anger as a normal stage of grief and offer support. Acknowledging the reality of the loss and the validity of the parent's emotions is the most therapeutic approach. Question 92. Which symptom is consistent with a uterine rupture during labor? Option A. A large gush of clear fluid. Option B. High blood pressure. Option C. Abdominal rigidity and tenderness. Option D. Increased fetal movement. The correct answer is option C. Abdominal rigidity and tenderness. A ruptured uterus is a surgical emergency often presenting with a rigid abdomen and signs of shock like low blood pressure. Question 93. Why are heat and enemas contraindicated for a child with a fever and abdominal pain? Option A. The symptoms are likely caused by constipation. Option B. Heat helps relax the muscles too much. Option C. Both increase intestinal motility and the risk of perforation. Option D. Stomach aches are usually best ignored. The correct answer is option C. Both increase intestinal motility and the risk of perforation. If the pain is caused by appendicitis, increasing movement in the bowel could cause it to burst. Question 94. What is the best way to help an 8-year-old and her family prepare for surgery? Option A. Take the child to her room and begin the prep. Option B. Take time to orient the child and family to the hospital and the events. Option C. Answer questions only after the child goes to the operating room. Option D. Tell them there is nothing to worry about. The correct answer is option B. Take time to orient the child and family to the hospital and the events. Orientation and preparation reduce the fear of the unknown for both the child and the parents. Question 95. What is important for a nurse to remember when caring for a child in skeletal traction? Option A. The nurse can lift the weights to move the child. Option B. Special skin care is needed at the pin site. Option C. The pull should cause immediate comfort. Option D. The child should be discouraged from self-care. The correct answer is option B. Special skin care is needed at the pin site. Pin site care is essential to prevent infection. The weights should never be lifted or removed by the nurse. Question 96. Which intervention is most effective in helping a child cope with the monotony of being in traction? Option A. Provide books and puzzles. Option B. Allow him to do as much for himself as possible, including pin site care. Option C. Have a volunteer read stories to him. Option D. Change his position and rub his back with lotion. The correct answer is option B. Allow him to do as much for himself as possible, including pin site care. Participating in their own care gives children a sense of control and helps them cope with being immobilized. Question 97. During the acute phase of osteomyelitis, nursing care is directed toward: Option A. Moving the affected leg carefully to minimize pain. Option B. Allowing the child to use a wheelchair. Option C. Providing a high-protein and high-fiber diet. Option D. Instituting immediate physical therapy. The correct answer is option A. Moving the affected leg carefully to minimize pain. The infected bone is extremely painful and any movement must be handled with great care. Question 98. A mother asks why her child's bone infection came back months later. What is the correct understanding? Option A. It is caused by poor nutrition. Option B. It results from an unclean environment. Option C. It is related to sluggish circulation. Option D. Sinuses in the bone can retain infectious material for a long time. The correct answer is option D. Sinuses in the bone can retain infectious material for a long time. In chronic osteomyelitis, bacteria can remain trapped in the bone tissue and cause later exacerbations. Question 99. What is the best way to relieve an anxious 5-year-old who is having a bone marrow aspiration? Option A. Explain what she will see and feel and hear. Option B. Remind her she has done this before and it is nothing to fear. Option C. Tell her it will be over soon so she can go play. Option D. Give her a hug and tell her to be a big girl. The correct answer is option A. Explain what she will see and feel and hear. Honest explanations tailored to the child's level of understanding help reduce anxiety more than false reassurance. Question 100. What should parents be told about the hair loss associated with chemotherapy? Option A. Children seldom care about losing their hair. Option B. The hair loss is gradual and not very noticeable. Option C. It is best to choose a wig before the hair falls out. Option D. Parents will get used to it quickly. The correct answer is option C. It is best to choose a wig before the hair falls out. Having a wig ready can be a huge psychological boost for a child and helps with the transition to hair loss. Question 101. Which strategy encourages a child with no appetite during chemotherapy to eat? Option A. Provide a large balanced diet and restrict dessert. Option B. Schedule procedures immediately after meals. Option C. Offer highly seasoned and diverse foods. Option D. Offer smaller and more frequent meals with favorite foods. The correct answer is option D. Offer smaller and more frequent meals with favorite foods. Small portions of familiar favorite foods are less overwhelming and more likely to be accepted. Question 102. What is the purpose of protective isolation for a child with a low white blood cell count? Option A. To provide the child with privacy. Option B. To protect the family from visitors. Option C. To protect the child from infection. Option D. To isolate the child from the nursing staff. The correct answer is option C. To protect the child from infection. Neutropenic children have almost no defense against germs, so they must be protected from pathogens in the environment. Question 103. Which intervention is most effective for a client with painful mouth ulcers from chemotherapy? Option A. Apply local anesthetics 30 minutes before meals. Option B. Offer a bland and moist and soft diet. Option C. Provide distraction during meals. Option D. Clean the mouth with lemon glycerin swabs. The correct answer is option B. Offer a bland and moist and soft diet. Soft bland foods are less irritating to the sores. Swabs with lemon or glycerin should be avoided as they dry out the mouth. Question 104. How can a nurse help an adolescent with cystic fibrosis meet their caloric goals? Option A. Include the client in planning meal plans and food choices. Option B. Devise a diet with a nutritionist without the client. Option C. Select foods and institute a strict calorie count. Option D. Provide chips and candy instead of meals. The correct answer is option A. Include the client in planning meal plans and food choices. Adolescents are more likely to comply with a diet if they have a sense of control and are involved in the process. Question 105. What is the best way to evaluate if a child with cystic fibrosis is getting enough calories? Option A. Carefully monitor weight gain or loss. Option B. Record the types of foods eaten. Option C. Keep a strict calorie count. Option D. Count the amount of pancreatic enzymes taken. The correct answer is option A. Carefully monitor weight gain or loss. Consistent weight gain is the most reliable indicator that the body is receiving and using enough nutrients. Question 106. What is the ultimate aim of physical exercise for a child with cystic fibrosis? Option A. To create a sense of well-being. Option B. To help overcome respiratory infections. Option C. To establish an effective and habitual breathing pattern. Option D. To promote normal growth and development. The correct answer is option C. To establish an effective and habitual breathing pattern. Exercise is used as an addition to chest therapy to help move mucus and improve long-term lung function. Question 107. Why must a nurse take a threat of suicide seriously in an adolescent with cystic fibrosis? Option A. It is just a bid for attention. Option B. No threat should ever be ignored or challenged. Option C. He is just depressed about his illness. Option D. The client needs to be confronted and forced to work through it. The correct answer is option B. No threat should ever be ignored or challenged. Chronic life-threatening illnesses can lead to genuine despair, and any mention of suicide must be evaluated immediately. Question 108. Which sign in a 9-month-old infant would indicate a possible cerebral injury? Option A. Neck pain on flexion. Option B. Holding the head to one side. Option C. Holding the head midline when vertical. Option D. Significant head lag when raised to a sitting position. The correct answer is option D. Significant head lag when raised to a sitting position. By 6 months of age, a child should no longer have head lag. Its presence at 9 months is a sign of neurological damage. Question 109. Which nursing intervention is most effective for resolving a diaper rash? Option A. Coating the area with zinc oxide. Option B. Using talcum powder. Option C. Removing the diaper for extended periods of time. Option D. Using disposable wet wipes at every change. The correct answer is option C. Removing the diaper for extended periods of time. Exposing the skin to air and light is the fastest way to promote drying and healing. Question 110. What is the best way to introduce solid foods to a 10-month-old who only wants milk? Option A. Limit milk to 4 bottles a day. Option B. Milk meets all needs so solids can wait. Option C. Give a vitamin supplement and continue whole milk. Option D. Offer iron-enriched solids before giving the bottle. The correct answer is option D. Offer iron-enriched solids before giving the bottle. Offering solids when the infant is hungriest increases the chance they will accept new foods. Question 111. Why are primary nurses assigned to an infant with non-organic failure to thrive? Option A. The nurses can learn the infant's specific cues and feeding behaviors. Option B. It prevents parental fatigue. Option C. It prevents infant fatigue. Option D. It ensures the family has privacy. The correct answer is option A. The nurses can learn the infant's specific cues and feeding behaviors. Consistent caregivers can better understand the infant's needs and build the relationship necessary to improve feeding. Question 112. What is a sign that a 2-year-old is ready for toilet training? Option A. The child is patient when wearing soiled diapers. Option B. The child communicates the urge to go. Option C. The child awakens wet from every nap. Option D. The child's siblings were trained at the same age. The correct answer is option B. The child communicates the urge to go. The ability to recognize and communicate the need to use the bathroom is a primary indicator of readiness. Question 113. Why does a nurse encourage the family to bring a child's favorite objects to the hospital? Option A. To reduce fear of the unknown. Option B. To keep the child calm. Option C. To establish trust. Option D. To prevent or minimize separation anxiety. The correct answer is option D. To prevent or minimize separation anxiety. Familiar objects provide a sense of security and help the child feel connected to home and family. Question 114. Why does a nurse monitor the temperature of a child in an oxygen mist tent? Option A. To prevent undue chilling from the cool mist. Option B. To detect rapid temperature spikes. Option C. To prevent febrile seizures. Option D. To prevent airway obstruction. The correct answer is option A. To prevent undue chilling from the cool mist. The tent creates a cold and damp environment which can cause the child to become dangerously chilled. Question 115. A child with asthma becomes irritable and has a racing heart before discharge. What is the priority action? Option A. Hold the discharge for an hour. Option B. Notify the physician immediately. Option C. Discharge the child as ordered. Option D. Administer an antiemetic. The correct answer is option B. Notify the physician immediately. Nausea, irritability and tachycardia are signs of theophylline toxicity and must be reported immediately. Question 116. Which nursing diagnosis is the top priority for an infant with pyloric stenosis and weight loss? Option A. Fluid volume deficit. Option B. Altered nutrition. Option C. Altered bowel elimination. Option D. Anxiety. The correct answer is option A. Fluid volume deficit. Dehydration from constant vomiting is a life-threatening emergency that must be corrected with intravenous fluids. Question 117. Prolonged projectile vomiting in an infant can lead to which acid-base imbalance? Option A. Respiratory acidosis. Option B. Respiratory alkalosis. Option C. Metabolic acidosis. Option D. Metabolic alkalosis. The correct answer is option D. Metabolic alkalosis. Vomiting results in a loss of stomach acid which causes the body to become too alkaline. Question 118. Which activities are most appropriate for a toddler? Option A. Stringing beads and cutting with scissors. Option B. Mobiles and rattles. Option C. Pull toys and large balls and water play. Option D. Simple card games and puzzles. The correct answer is option C. Pull toys and large balls and water play. Toddlers need activities that promote large muscle movement and sensory exploration. Question 119. Which item can help a 5-year-old express her feelings about being in the hospital? Option A. Books with pictures. Option B. Music. Option C. Writing toys. Option D. Puppets. The correct answer is option D. Puppets. Puppets allow children to act out their fears and communicate feelings they cannot express directly. Question 120. Why might a hospitalized 3-year-old become unusually aggressive during play? Option A. He has deep-seated hostility. Option B. He has a lack of interest in socializing. Option C. This is his normal behavior. Option D. It is a coping response to stress. The correct answer is option D. It is a coping response to stress. Aggression is often a way for young children to handle the stress and lack of control they feel in a hospital setting. Question 121. What is the most essential nursing action in the first 24 hours for a child with a new arm cast? Option A. Mobilization of the child. Option B. Discharge teaching. Option C, pain management. Option D, assessment of neurovascular status. The correct answer is option D, assessment of neurovascular status. Checking for circulation and nerve function is critical because swelling can make the cast too tight and damage the arm. Question 122. Which skill missing in a 9-month-old would be a developmental concern? Option A, she sits briefly alone with assistance. Option B, she creeps and crawls. Option C, she pulls herself to her feet. Option D, she stands while holding furniture. The correct answer is option A, she sits briefly alone with assistance. By 9 months, an infant should be able to sit alone for long periods without any help. Question 123. What is another name for myopia? Option A, cataracts. Option B, farsightedness. Option C, nearsightedness. Option D, lazy eye. The correct answer is option C, nearsightedness. Myopia is the medical term for being able to see near objects clearly while distant objects are blurry. Question 124. A student complains of difficulty seeing the blackboard and squints frequently. These are symptoms of option A, astigmatism. Option B, hyperopia. Option C, myopia. Option D, amblyopia. The correct answer is option C, myopia. Squinting and difficulty with distance vision are the classic indicators of nearsightedness. Question 125. A client has chest tightness, dyspnea, and expiratory wheezing. These signs alert the nurse to option A, attention pneumothorax. Option B, an asthma attack. Option C, pneumonia. Option D, pulmonary embolus. The correct answer is option B, an asthma attack. Expiratory wheezing and airway obstruction are the defining characteristics of an asthma attack. Question 126. Which vitamin is most essential for promoting tissue healing after surgery? Option A, vitamin C. Option B, vitamin B1. Option C, vitamin D. Option D, vitamin A. The correct answer is option A, vitamin C. Vitamin C is critical for the formation of collagen and the repair of skin and tissues. Question 127. Which meal choice is best for a postoperative client who needs vitamin C for healing? Option A, liver and white rice. Option B, fish and carrots. Option C, roast chicken and gelatin. Option D, chicken with tomato sauce and orange slices. The correct answer is option D, chicken with tomato sauce and orange slices. Tomatoes, oranges, and strawberries are all high in vitamin C. Question 128. What is the purpose of skeletal traction using pins and weights? Option A, to provide a steady longitudinal pull on the bone. Option B, to suspend the leg without any pull. Option C, to provide intermittent pressure on the spine. Option D, to maintain a pull on the upper body. The correct answer is option A, to provide a steady longitudinal pull on the bone. Skeletal traction applies a continuous pull directly to the bone to keep a fracture aligned and immobilized. Question 129. What is a normal finding at the site of a traction pin insertion? Option A, active drainage of fluid. Option B, a dry and scaly crust. Option C, significant swelling. Option D, redness and heat. The correct answer is option B, a dry and scaly crust. A dry crust is a normal part of the healing process and should not be removed. Question 130. A physician suspects a urinary obstruction by a stone. Which test confirms the location and the degree of obstruction? Option A, cystoscopy. Option B, abdominal X-ray. Option C, intravenous pyelogram. Option D, ureterolithotomy. The correct answer is option C, intravenous pyelogram. An intravenous pyelogram uses dye to show exactly where a stone is blocking the flow of urine. Question 131. What type of pain is caused by a stone in the renal pelvis or upper ureter? Option A, radiating pain into the testicles or labia. Option B, urinary frequency and burning. Option C, severe flank and abdominal pain with nausea and sweating. Option D, dull aching back pain. The correct answer is option C, severe flank and abdominal pain with nausea and sweating. Stones higher up in the urinary system cause intense flank pain and systemic symptoms like vomiting. Question 132. A client with gout is most likely to form which type of stone? Option A, struvite. Option B, staghorn. Option C, uric acid. Option D, calcium. The correct answer is option C, uric acid. Gout involves high levels of uric acid which can crystallize into stones in the kidneys. Question 133. Pneumococcal pneumonia is caused by which type of organism? Option A, gram-negative bacteria. Option B, gram-positive bacteria. Option C, a non-bacterial agent. Option D, a virus. The correct answer is option B, gram-positive bacteria. Pneumococcal pneumonia is the most common form of gram-positive bacterial pneumonia. Question 134. What type of sputum is characteristic of gram-positive bacterial pneumonia? Option A, bright red with streaks. Option B, rust-colored. Option C, green. Option D, pink and frothy. The correct answer is option B, rust-colored. Rust-colored or green productive coughs are typical signs of this infection. Question 135. Why does a client with pneumonia become irritable and restless? Option A, prolonged bed rest. Option B, maintaining a semi-Fowler's position. Option C, cerebral hypoxia. Option D, high amounts of intravenous fluids. The correct answer is option C, cerebral hypoxia. Irritability is often an early sign that the brain is not receiving enough oxygen. Question 136. A client having an asthma attack suddenly stops wheezing. What should the nurse do first? Option A, place the client in a supine position. Option B, draw blood for gases. Option C, start oxygen at 4 liters per minute. Option D, establish a patent airway. The correct answer is option D, establish a patent airway. The sudden silence indicates a complete airway obstruction, which is a life-threatening emergency. Question 137. Where are the stones located in a client with cholecystolithiasis? Option A, gallbladder. Option B, kidneys. Option C, common bile duct. Option D, bladder. The correct answer is option C, common bile duct. Cholecystolithiasis specifically refers to the presence of gallstones within the common bile duct. Question 138. Which sign is positive when a client with cholecystitis cannot take a deep breath during gallbladder palpation? Option A, Cullen's sign. Option B, rebound tenderness. Option C, Murphy's sign. Option D, Turner's sign. The correct answer is option C, Murphy's sign. Murphy's sign is a classic indicator of an acutely inflamed gallbladder.